ではですね、ディスクシールケビン先生はディスクシール治療を長いこと行われてきましたけども、最近エクソソーム治療を一緒に組み合わせているというのを伺いました。ディスクシール単体もとてもいい治療だと思います。でも、最近エクソソームの治療っていうのが、認知されだして広く行われ始めました。で、実際エクソソーム治療を行っているところも、世界中でも少しずつ増えてはきてはいるんですけども、今回、ディスクシールとエクソソーム、これをどう組み合わせるとより効果的か、どういうケースに、そういう治療が適用するのか、そこにちょっと詳しくお伺いできればなと思いますので、よろしくお願いします。
So we know that the Discseel procedure works very well. It uses fibrin and it regrows the disc. And we also know that there's something very special called exosomes. And exosomes are the brain of the stem cell. Many years ago, doctors used stem cells, and stem cells are old technology, something of the past, because today we have the ability to get the stem cell as an exosome. We get the brain of the stem cell. And so that's what we have available. And that's what you have available at your center. Many places say that they offer exosomes, but those are not true exosomes. Without getting into the details, many of those centers simply filter tissue and then they sell it as exosomes. But instead, these are the true exosomes. These are the only true exosomes available. And we recognize that fibrin heals tissue, and we recognize that exosomes heal tissue with different pathways. And so we thought that there would be synergy if we put the two together. And only with the Discseel procedure do you have the ability to seal the disc to allow the exosome to stay inside the disc. And so by putting those two things together, we're observing that the patient's results are even better than they were with the Discseel alone. The patients are recovering much faster than they were before. And one of the values of exosomes is that they're a very strong anti-inflammatory. And so many of the patients have less discomfort than otherwise. And so the exosomes have much added value. I'm very pleased that you're the center in Japan that offers the true exosomes because many patients from around the world previously traveled to the United States because we offered the true exosomes with the Discseel procedure. Many world leaders that you know from Europe, from the Middle East and Asia traveled previously to the United States. But now I'm so glad that they can travel to your center, the Nonaka Clinic, to receive the Discseel and these exosomes. So I'm very pleased that you're going to be able to help people from around the world, not just Asia, but people from around the world who seek us out because we offer these exosomes that nobody else offers.
ありがとうございます。一つですね、世間一般で、日本の話かもだけかもわからないですけども、PRP とエクソソームがやっぱり被る内容成分があるので、ちょっといろいろ混同されがちなんですけども、PRP を使うのとエクソソームを使うこの利点をまた教えてください。
PRP is very old-fashioned, and stem cells very old-fashioned. And many places are limited to only having PRP. But the exosome is so much better. And here's a way to think about it. When they use PRP, if PRP or stem cells ever work, the only reason they work is because of the exosome that's in the stem cell or PRP. The exosome is what matters. Now, the benefit to the exosomes that you have at the Nonaka Clinic is that you have the pure exosomes that are taken from the day that the child was born. So that's pure and it's unmutated. And so it has everything that's needed to grow and to heal. versus if we were to take stem cells from me or you to heal ourselves, which is so commonly done, that's not as good because our stem cells are older. Even if we're only 20 years old, that means that our stem cells, our cells have been alive for 20 years. And over time, these cells accumulate mutations when they divide. And so when they get PRP, it's accumulated mutations. And that's why it has limited value versus these exosomes. They have no mutations. They're pure. They're virgin. They're from that youngest day of life. And so they allow us to have that ability to heal ourselves, healing the spine, also healing the joints. They have tremendous value. Many pro athletes from around the world, football players, Olympic athletes come to us because this is the only place that they can receive true exosomes. And so now they'll be able to go to your clinic. The Nonaka clinic will offer the pure exosomes, allowing everyone to benefit from what was only limited to a few people in the past. So we're very honored that you're going to be able to help many people who understand the difference between the high value of an exosome versus the low value of stem cells and PRP.
今日本で使われているエクソソームっていうのはエクソソームの濃度が結構低いんですよね。で、効果も限定的だと考えているんですけれども、今回その濃度を上げた治療に関してですけれども、いろいろメリットデメリットがあると思うんですね。濃度が上がることでより効果的であるとは思うんですけれども、内容として減るリスクもあるかなと思うんですけども、エクソソームの今後の改善の余地とか、何か他と組み合わせたらいいかっていうのは、何か意見はありますか？
One of the strong benefits of the exosomes that you offer is that they have the pure exosomes, which are very important, but they also include all of the growth factors, all of the anti-inflammatory constituents that we see in much lower concentrations in other exosome products or even other stem cell or PRP products. All those things are very diluted there, whereas here, these exosomes are the pure exosomes along with every growth factor and anti-inflammatory factor that's necessary to help with the healing process and to help with improving the immune process. So for that reason, these exosomes are being studied for three different things. They have three values. The one value is that they improve the immune response. And so they're being studied at top centers to treat metastatic cancer and to treat infection in the ICU. So they increase the immune response. The second thing they do is they stop inflammation. And so they have much greater strength than steroid and none of the negative effects of steroid. That's the second reason we like them. The third reason is these exosomes have proven ability to accelerate wound healing and tissue healing, and that's been demonstrated in placebo-controlled studies. When we treat patients, just like you, we want to maximize the efficacy, but we also want to keep the cost as low as possible. We want people better. And so if they provide just a little exosomes, just enough that we put it in the disc, we seal the disc with fibrin, and then at that same time, we put exosomes into the fibrin sealed disc. And because the exosomes are so helpful, we use every last drop. We'll even then put any leftover exosomes into the IV, and then the exosomes go throughout the body and they seek out cells, they recognize inflammation, and they help heal cells that need healed. And so we use every last drop of the exosomes because it benefits the patient's spine plus other parts of their body.
ケミ先生も自分でエクソソームを使われていると伺いました。で、今回僕らもちょっと、それをトライしてみようと思うんですけれども、そのことに関して何か経験がございますか？
I must confess that in the past, I was very cynical of exosomes because I only knew of the other not good exosomes, the ones that are not such high quality. Now I mention that because for many years I had hip pain, a hip injury, and I did not want surgery. And so I went to the experts who did PRP, and I tried PRP, and it helped a little bit, but not much. And my office wanted me to have surgery because the doctor couldn't be limping around. And so then I tried stem cells of different types and PRP of different types from the experts. And I was scheduled for surgery because none of those helped me. And I was on the appointment for surgery. And then I had access to these true exosomes. And so I reached out and I treated myself with these true exosomes. And I injected it directly into my hip. And then I put part of it into the IV. And then the next day I had no pain. And it's been over 2 years now. I run 10 kilometers a day. I have no pain. And so that's why the exosomes caused me to want to study them for the spine. And it's only these exosomes that have provided relief when everything else has failed me personally. And so that's why I just want to help so many people. And I'm honored that you'll be able to help people from the entire world, but especially from all of throughout Asia and Europe and Africa and the Middle East. They'll be able to travel to you for these exosomes and for the Discseel procedure of the neck and the low back and even the thoracic spine.
なるほど。実際経験されてたんですね。
そうですね。まあ、ディスクシール単体でもとてもいい治療ではあるんですけれども、そこによりエクソソームを加えることで、より効果が高い、で、エキストラな効果もあるということを、伺いました。現状、選択肢としては他にいろいろあります。PRP もあるし、ステムセルを使う方法もいろいろあるんですけれども、やはりそこでいろいろうまくいっても、治療しても効果が出ないという方が、最終的にエクソソームに頼ることがあります。ですが、やはりエクソソームのこのクオリティが低い、濃度が低い、ここが一つ大きな問題だと思うんですね。追加版はとても、特に頸椎に関しては小さい。中に容量も少ない。やっぱりそこで、濃度の低いやつを使っても、やっぱり大した効果が得られないと思うんですね。なので、今回は特殊な治療です。この高濃度のエクソソームってすごい難しいんですよね。でもそれを、実現していて、でそれを頸椎に使うことでより効果的な成績が上がっていると。いろいろな可能性もね、とても感じて、今後の治療に関して選択肢が広がっていくんだろうなと思いました。